Hey guys, this is phase 2 of the knee osteoarthritis regimen. So in phase 1, we kind of started to get that knee moving a little bit, and we started to do a little bit of strengthening and a little bit of activation around the knee. Here in phase 2, we're going to expand upon that. So we're going to get the knee a little bit more mobile, kind of further into that range of motion, and now we're going to start to really get stronger. So the first exercise is called a quadruped rock back. And you're going to set up in the quadruped position or the hands and knees position. So if your knees are a little bit sensitive here, put a pillow underneath the knees. So what you're going to do is you're going to plant your back toes so the toes are kind of right on the ground. And you're going to sit your butt back towards your heels, pause for a second, and come back up. I love this exercise to get a little bit of weight bearing through those knees and to get into that deep knee flexion. So as we're rocking back here, our knees are really getting into that deep flexion position. It's a great exercise to kind of start habituating to that flexed position for knee osteoarthritis. For a good set and rep scheme here, you're looking at 2 to 3 rounds of about 8 to 10 repetitions, 1 to 2 times per day. So again, we're kind of rocking back, pause for a second, and then come back up. So from this position, we'll transition right into our next exercise. So the next exercise is a half kneeling or up on one knee hip flexor stretch. So from here, again, if your knee is a bit sensitive, just put a pillow underneath that plant knee. If your balance is a little bit of an issue for you, you can either hold on to a wall or hold on to a broomstick here. If the balance is less of an issue for you, kind of challenge the core. Go without upper extremity support. So what you're going to do is engage the core. So I tell my patients, if we're having a hard time kind of finding that core, imagine you're wearing a belt and you're kind of taking that belt buckle towards your nose a bit. So you're kind of tucking that belt up just a touch to kind of find that lower core. From here, you're going to rock forward. So I'm not losing that heel. My heel stays down. I'm rocking forward, keeping that core engaged and avoiding extension at my spine. So I'm engaging here, rock forward, and we're just going to hold this position for about 30 seconds. Again, you can hold on to a wall if you need help kind of finding that spot. And we're going to hold this for 2 to 3 rounds of 30 seconds. So on the other side, it's going to look like this. We're coming up into one knee, engage that core, and shift forward. This knee is kind of coming forward towards the toe. I'm getting a really good stretch on the opposite side hip flexor. Holding for 30 seconds, 2 to 3 rounds, 1 to 2 times per day. All right. From there, we're going to advance your hamstring stretch from phase 1. So in that first regimen, we used the jump strap. In this regimen, we're going to use a chair. It's just going to get you into a little bit different of a stretched position. So what you're going to do, and again, if balance is an issue for you, hold onto a wall or onto a broomstick. You're going to lift your leg up onto the chair, and we can kind of bias which area of the hamstring we're stretching here. If your knee is all the way straight, you're going to feel it distally or kind of right behind the knee. If your knee has a deep bend in it, you're probably going to feel it closer towards the glutes or more proximally. So I say usually kind of start with a soft bend. If you feel like you need that stretch in a little bit of a different area, those are the ways you can kind of adapt it. Toe is going to be kind of pulled up just a touch, and then we're going to keep our core engaged, so keeping that back straight. Take the belly button towards the toe just until we feel about a moderate stretch, about 4 or 5 out of 10 intensity stretch. And then same dosage as that hip flexor stretch, we're going to hold for about 2 to 3 counts of 30 seconds, 1 to 2 times per day. So on the other side, it's going to look like this. So again, holding onto a wall or onto a broomstick if we need. We're lifting that foot up, kind of playing with that knee flexion angle or how much knee bend we have to kind of find the appropriate stretch for us. Taking belly button towards that toe, holding for about 20 to 30 seconds, about 2 to 3 rounds, 1 to 2 times per day. All right. And then from there, since we've got our chair out already, we're going to go into an exercise called a sit-to-stand. So you're going to cross your arms over your chest, and we're going to start by sitting on the chair, and then you're going to stand up and sit down. Okay, standing up and sitting down. Now with this exercise, Imagine that you're sitting on something fragile, so something breakable, and we want to really ease onto that pressure and then come back up. If you're looking to challenge yourself even a little bit further, as soon as you feel the pressure of that chair, come right back up. So as soon as I'm feeling that chair kind of on my glutes, I'm right back up. To make this exercise a little bit harder or easier, play with the height of the chair that you have. So the higher the chair is, the more comfortable it's going to be on your knees and a little bit easier exercise it's going to be. If we want to get a bit deeper, or if the knees are feeling pretty good that day, kind of challenge yourself and use a little bit of a deeper seated chair. So this chair is kind of meeting me at about, right about a 60 degree knee flexion angle. And that's a really nice way to start to get those knees stronger without overly stressing them. So arms are crossed, we're sitting up, we're sitting down and standing up. The dosage for this one is going to be about 3 sets, 8 to 10 repetitions here, 1 to 2 times per day. So then we're going to put our chair away. So we're going to lift the chair out of here. We'll go back on our back here. We've got 2 more exercises here with phase 2. And the next one is a glute bridge. So in phase 2 here, we're just going to do a double leg glute bridge to kind of get those glutes and hamstrings going. So you're going to kind of dig the heels in and engage the core. So remember, belt buckle kind of towards nose. Hold that position to engage that core. Lift your butt up into the air. Hold 1 to 2 seconds and come back down. As I lift my butt, I'm squeezing and engaging those glutes, holding 1 to 2 seconds and back down. If this exercise is pretty tough for you, or if we're getting some cramping kind of in those hamstrings, use your arms to give yourself a little bit of tension. So I'm kind of driving the arms into the ground to help me find a little bit more core stability. If this exercise is pretty easy for you and we're not quite ready for phase 3, just go ahead and lift your arms up, and that way we're getting a little bit more pressure on those glutes and hamstrings. Okay. Set and rep scheme for this one is going to be about 3 sets, 8 to 10 repetitions, about 1 to 2 times per day. All right, and then our last one of regimen 2 here, phase 2 here, is going to be the sideline straight leg raise. So you're going to lay on either side here, because we're going to do both sides. The bottom leg is going to be bent. So my bottom leg is bent. My hip bones are stacked. So I'm taking this hip bone and I'm rolling forward. The most common error I see, or the most common compensation I see with this one, is people leaning back too far. So we're keeping this hip bone forward and this leg straight. And then what you're going to do is lift that leg up towards the ceiling and back down. I'm squeezing kind of my side butt or my side glute for this one. Lift and back down. Additionally, what we're trying to avoid is that leg coming forward as you lift. So the leg stays back the whole time. So every single time I lift, that leg should stay kind of right back behind me just a touch, so that we're really focusing on getting that glute engaged and not just the quad or hip flexor. Set and rep scheme for this one is going to be 2 to 3 rounds of about 8 to 10 repetitions. Should be feeling our back pocket lighten up. If we're feeling only on the front of that thigh, a couple things to kind of look to adjust is number 1, drive that hip a little bit further forward, and number 2, extend the leg just a touch more. So bringing the heel back towards the wall or back behind you just a little bit more. Okay. 2 to 3 rounds, 8 to 10 repetitions with that one. So that is all for regimen 2 or phase 2 of the knee osteoarthritis program. So go through that. Once you feel like you're comfortable with that one, go ahead and jump on to that 3rd and final phase. All right, thanks for watching, guys.